Hi everyone! So today we are going to be talking about RSV epidemiology. A lot of us have probably noticed that throughout the community there has recently been an increase in cases, especially in comparison to years prior. So today we are going to be discussing what exactly RSV is, as well as how it is transmitted, and we're also going to be looking at cases on a graph. We're going to be examining epidemiology and recent surges along with different testing types. So as a lot of you probably know, RSV stands for respiratory syncytial virus. This is a disease that causes symptoms that are very similar to what you would traditionally experience with a cold, but it can actually be very serious for young children, babies, as well as elderly individuals, and especially those who are immunocompromised. Throughout the United States, in children who are under 1, RSV is the most common cause of inflammation of the small airways in these children's lungs, and they can even contract pneumonia as a result. And I'm sure you all will go into much more detail regarding RSV in your other classes, but I did want to give a brief overview. So now let's investigate RSV transmission. How exactly are the most common ways that you can get it? Well, droplet transmission, which would be through the air. You can be having a conversation with someone, usually for a prolonged period of time, and then eventually the droplets from their mouth can come into contact with yours and you would get it that way. Or even if you're around somebody who is sneezing or coughing, could also be a potential method of transmission. Now, getting down to the technicalities, sneezing and coughing are actually forms of droplet transmission, and traditionally these droplets only travel pretty short distances. On average, it's usually about 2 meters or less before they do ultimately end up settling. But I do need to elaborate a little bit. It is not only transmitted through droplets, it can also be transmitted from surface to surface, which we will cover and discuss momentarily. The next slide demonstrates why it is so important to make sure that you are covering your coughs and your sneezes. This is absolutely imperative during RSV season. But honestly, covering your mouth needs to happen year-round in order to prevent disease transmission, whether we're discussing RSV or the flu or any other type of infectious disease that can be transmitted through droplets. So like I've mentioned before, droplet transmission is not the only way that you can get RSV. Direct contact can also transmit it. So for example, if a family member kisses a baby on the face, that can then cause the baby to get infected with RSV. And also just touching surfaces with the virus on it. That's why washing your hands is the #1 way to prevent the spread of any illness. So what is the incubation period for RSV? Just as a refresher, let's define what that is. So an incubation period is usually the time that it takes for symptoms to show after someone has come into contact with the disease. So if we are talking about RSV specifically, we can expect to see symptoms show up anywhere from 2 to 8 days after that initial contact with the person who tested positive. However, it does usually take an average of about 5 days for these symptoms to show. So if you've come into contact with somebody who you know has tested positive for the disease, you can keep track of this yourself. You can say, okay, I've reached day 8 and I still haven't exhibited any symptoms yet, so I'm likely in the clear. But if you do start showing symptoms of RSV, what should you expect? Well, like I said before, it's very similar to a common cold. You can anticipate getting a fever, having a runny nose, potentially experiencing some coughing, wheezing, and maybe even an ear infection, as these are common as well. So now let's jump into RSV epidemiology. So it's estimated that this virus infects 90% of children within the first 2 years of their life. And most individuals who have it do have upper respiratory illness and not lower. However, others can develop lower respiratory tract illness, but this is usually bronchiolitis. It is noticed that infants do traditionally have the highest risk of developing lower respiratory distress, and up to 40% of these infections do lead to bronchiolitis. Throughout the world, RSV is responsible for approximately 33 million lower respiratory tract illnesses, and it also averages 3 million hospitalizations and up to 199,000 childhood deaths, which is just so sad and devastating. So let's visualize all of this information. This is RSV data throughout the United States, and as we can see, there's 3 different colored trend lines. The blue one is for antigen detection, the orange, which is for virus isolation, and then the purple, which is PCR detection. So these are different ways that you can test for the presence of RSV in a particular individual. As we look at the y-axis, we can see the percent positive, and the x-axis represents the current timeline that we are looking at. So at the time of recording this video, this chart depicts cases from January 2021 all the way up until the end of December 2022. As we can see, virus isolation appears to be the least common method of testing for the presence of RSV. However, antigen detection and PCR detection are both relatively popular. So regarding interpretation, we can see that there was a massive peak in positive antigen detection test for RSV around late June of 2021. And we also see a pretty drastic spike around late October to early November of 2022. However, this is in all testing types. This is in antigen detection, virus isolation, and also PCR detection. So just based on what we're seeing here, we can tell that they ramped up all 3 testing types after that massive surge, where it was primarily just antigen detection being used, but we can also see that PCR was also an option. So as we saw in that chart, there are different testing types for RSV. There's antigen detection, PCR testing, and also virus isolation. However, a recent study that is referenced by the CDC discovered that PCR is actually the best testing method for RSV specifically. It also helps to determine the seasonality of RSV. It is estimated that they provide a better understanding of trends, and this particularly happens where testing and reporting is the most active, but this will vary depending on the location in which the testing is occurring. So using these different testing methods, we can actually look at these different epidemiological charts and determine when RSV usually peaks. So on average, we do see an RSV season onset of mid-September to mid-November. The peak usually occurs from late December to mid-February, which at the time of filming this video, we are in right now. And then RSV season offset is anywhere from mid-April to mid-May on average. So that's really important for your future healthcare careers to know when you should expect to see these different trends and surges in cases. That way, you will be able to be prepared for what you may potentially encounter within the workplace. And like we saw on that graph, RSV has suddenly been surging. But why is that happening? So in the winter of 2020 and 2021, RSV cases were down significantly in comparison to other years. And according to a bunch of research articles, they determined that this was likely because of isolation protocol, as well as mask wearing and social distancing, because both of these times were peaks of the COVID-19 pandemic. So it's pretty easily hypothesized that that was the likely cause. As a result, a large number of young children did not develop natural immunity to RSV. In return, this increased the potential for an RSV surge to occur. And this occurs along with increased incidence and also out of season activity, which we did note on the graph. And additionally, we have seen an increase in health service pressure throughout the nation. I hope you all enjoyed and learned something from this video. In the future, we are going to be covering pneumonia, COVID-19, and influenza as well. Thank you.